You are in the first session for the mobility track. Okay, so if you don't want to be here, feel totally upset. I'll close those doors, but you may leave. But it's also, even though you're here for the first track of the mobility session, you could be going to policy or infrastructure, for the second and the third. Even though we want to continue to keep you with us, and maybe after you hear how we've organized these three sessions, you'll stay with us. But also, I'm thrilled that each as you heard from Dean Jackson, all these are being recorded and hopefully edited, and you'll be able to listen to these presentations at your own leisure. So to start us off, this track is the transition from driver to passenger and the role of senior-friendly transportation options. I introduce myself. We have Jana Hunkler from Berkshire Community Action Council, BerkshireRides. Helen Kerschner, the National Volunteer Transportation Center Director, part of Community Transportation Association of America. And Helen is, even though the center, she spends her time in D.C., she's actually, she flew in from Albuquerque, New Mexico yesterday to be with us. Bill Henry is from Volunteer Insurance Association, SEMA, in Virginia. And Bill is here because usually when you have the discussion of volunteer driver programs or senior transportation, one of the first non-starters to that conversation is risk and liability. So Bill is here to talk to us about those issues. And then we have a discussant, Noah Berger, representing the Federal Transit Administration. So our starting point for all three sessions in our mobility track today, and here's the starting point. So as we heard, most older drivers are safe drivers. And the key message here is it's not about age. It's about the medical conditions that impact critical driving skills. And most older adults today in the U.S. get around their communities as drivers in their own passenger vehicles or as passengers in those vehicles. And actually, when you start thinking about it, that's probably close to about 90%, and then it drops down to about 10% who take public transportation where it exists, okay? And then it goes down further to bicycle and to walking or to taking taxis, down to about 2%. Female non-drivers outnumber male non-drivers 3-1. So aging in many ways is a women's issue, and this issue in terms of this current cohort of older women is that they're more vulnerable to lack of mobility. And that we know, why are gerontologists so interested in this issue, is that driving cessation is associated with increased social isolation. You start restricting your driving space even more and more and more. I'm not going to go out at night. I'm not going to go out in bad weather. I'm not going to drive on highways till you're not doing anything, and you just, you risk the social isolation. Increased symptoms of depression, which go along with that, and we know that it's accelerated health declines. So I already reviewed that. I'm not going to have to. And the concern for isolation. So this was an aha moment for me as a gerontologist to look at Linda Bailey's 2004 report, Stranded Without Options. Of all older non-drivers, 54% do not leave their home on a given day, while only 17% of drivers stay home. This was something that that really resonated with me in terms of why this social isolation is so important. And here's the other aha moment to me as a gerontologist, and this was Dan Foley's work. In the U.S., men outlive their ability to drive safely by about 6 years, and women outlive their ability to drive safely by about 10 years. And more than 600,000 people aged 70 and older stop driving each year. And so the message here is that we all should be planning for our non-driving years. It's not just those people, it's that we all should be planning that. So that's another message that I want you to have. So in my mind, this is a community mobility continuum. Everything from screening, which is informal, to formal assessment, and that's, we've got wonderful occupational therapists who do specialized driving assessment and on fitness to drive, to monitoring and the introduction of community mobility options, to introduction and to the introduction of travel training and mobility management. People who work with persons with disabilities, this is known to that network. The Aging Network has been slowly trying to understand what a travel trainer is, what a mobility manager is, and what this means in terms of aging. And our next couple of sessions really deal with that. And then my vision, which totally doesn't exist at this point, is the idea of supportive, not only senior-friendly, but dementia-friendly transportation. About 20% of persons with Alzheimer's disease or related disorder are living in the community. No, they're living alone in the community. About 80% are living in the community. And Alzheimer's issue of dementia could be like 8 to 20 years. So if you're not fit to drive, but you still want to be engaged in your community, you're not able to give up driving and then hop on a bus. So with that, I suggest to you that the ultimate outcome is mobility, and if driving cessation is recommended, then other mobility options must be explored, created, and mastered. Thank you. And now we're going to turn to Jana.
So as Nina said, I'm Jana. I'm over from the Berkshires. I'm from an agency called BerkshireRides, and we're a small agency that started out doing employment transportation, expanded into mobility management and travel training, and recently we merged with our community action agency, which is going to give us a lot further reach than our little tiny mission. So we're in flux. BerkshireRides. Like I said, we do employment transportation, so we augment the fixed route bus. We started out giving rides in 2002, partnering with the BRTA, our Regional Transit Authority, and we bring people back and forth to work when the bus doesn't work for them. So if they live in a community that doesn't have a bus line, doesn't have a bus route, if they work odd hours, the bus in the Berkshires runs from 6 to 6, Monday to Saturday. So anybody that works second shift, they take the bus to work, we bring them back home. We help to keep people employed. We also have a small community fleet. We own a few vehicles that agencies that are too small to have their own transportation but do have a transportation need can use these vehicles to bring people back and forth to programming. We do information referral, and we do travel instruction, which is what I'll talk about today. So folks, do people understand what travel instruction is? I know there's a couple travel instructors in here. And how about a show of hands of if you live in a metro area that has pretty solid bus service? Okay, so where you have pretty solid bus service, you have the potential to have pretty robust travel instruction, and there's more options, more places the buses go, and more hours. But even in a rural area like the Berkshires, as you saw in those slides there, we have a lot of seniors. You still can use travel instruction as a viable way to get back and forth when you don't drive, for whatever reason, whether you're young, old, disabled. So we focus on teaching individuals how to safely and independently move around in the community using public transportation. We get them out of their car for some or all of their trips and into a safer mode. And what we do in travel training, the purpose is to support people with disabilities, seniors, and any kind of non-drivers. It's also really useful for young folks before they drive, high school kids, and people just starting to drive. One of my goals that I don't know how I'm going to accomplish this, but it'll be my retirement goal, is I think there should be a travel instruction module in every driver's ed class. So usually, kids, they're riding with somebody, they're, they may use the bus a little bit, they turn 16, they get their license, and they're in a car. So if we could somehow get them to have to use the bus once or twice, and they know that backup from the time they're 16 or 17, it doesn't feel like a loss when you get older. It's not a replacement, it's just another option. So someday we'll do that in Massachusetts. Who benefits from travel instruction? Of course, persons with disabilities that aren't able to drive because of a physical or cognitive limitation. High school students, as I said, before they start to drive, but it'd be great if it was a backup for after they start to drive as well, and seniors. In the classroom, travel instruction, we talk about a whole variety of things, and we develop curriculum dependent on the audience. So we may talk about how to safely cross a street, how to, stranger danger, if you need to interact with strangers. A lot of people that have never taken the bus are afraid to because it's sketchy. Once they're on there, they realize that, you have your own space, it's safe, it's clean, and it's efficient. How to be prepared for unexpected circumstances, and that can apply to seniors as well as people with disabilities. If the bus is late, if you miss a connection, if you have to get off at a different place, how to negotiate that. And as your cognitive ability declines, some of those things make you not want to try something different and new. What do you do if you get lost? If you have to go through a busy station where you have to change buses and you end up, on the wrong side of the tracks? And self-advocacy, be able to go up to somebody and ask them questions, who to look for. Those are all things that kind of take away the fear of using public transportation. And then what do you do? So you get someone comfortable, they feel like they're okay, they can move around. They also need to learn how to plan their own trip. How do you read a schedule? Who do you ask for help for? What does it mean to get a transfer? In the Berkshires, you have to actually go to the bus driver and say, I need to get on the bus to Williamstown. So they'll give you a transfer. You don't have to pay twice. The things they also do for us is that if your bus is a little bit late and the bus driver knows that you need to make a connection, they'll call ahead and the other bus can wait 4 or 5 minutes. So those kind of things, that's part of self-advocacy as well. You got to be able to say when you get on, this is what I need to do, and feel comfortable doing that. When you're on the bus, you have to follow the rules. That's not always a stranger. That's not always a senior issue. Sometimes that's more of a high school kid issue of, what's appropriate behavior on the bus. And we talked a little bit about stranger danger. Once you get on the bus, for people that have never used it, especially folks that have always lived in the Berkshires and never even been exposed to anything like that, what's a fare box? We just went from cash to a Charlie card system, and that was a big change. Like, people have the card, like, do I tap it? Do I swipe it? What does it mean? How do I know if there's money left on it? Sometimes something as simple as that will prevent someone from trying an alternative method. How to recognize landmarks, probably not a huge issue with seniors, but some it will be if they're going into a place that they haven't been familiar with. Seating, stops, how to request a stop. If you want to get off a little closer to your destination, there's always a pull chain and the driver can stop as long as it's safe. You don't have to ride all the way to the next bus stop. And I wanted to give a couple of stories. I know there's some travel trainers in here. Do you have seniors as a high population, or do you work more with folks with disabilities? Yeah. Yeah. We're just starting to expand our program at BerkshireRides. We've been doing travel instruction, I think, now for 4 years. By default, a lot of our clientele are referrals from agencies that support people with disabilities, but we have done some work in the senior centers. And sometimes, there's a senior that may have a disability, and so they fall into a couple categories. This year, what we're working on is actually partnering with the RTA and coming up with a program that's going to have one call number, and the RTA has people that do orientation and do some group training. So what we hope to do is we'll parcel out, the call will come in, and then we'll parcel out the work to the most appropriate trainer. And have some kind of a consolidated marketing program so that people really know what's out there and what it means. Just to see, here's travel instruction. No one really understands what that means where we are anyway. So we have a couple of folks just to demonstrate how it can really work, really in any area. We had a woman who is a non-driver. She was in her early 70s, and her husband passed. He was always the driver. So all of a sudden, she's still in her home. She's perfectly functional. She's never had a driver's license. And in the Berkshires, like in the Cape, that means you really can't get anywhere except maybe you could get to, a 7-Eleven and get a half a gallon of milk. But distances are long. So you wait for your kids to bring you somewhere, or you have a neighbor that happens to still be driving. My mom does that. Her neighbor, who's 92, has never driven. And they live in the town of Florida, which is way out of everywhere. There's 600 people that live in the town, and there's nothing you can get to. So my mother, who's 87 and maybe should be limiting her driving, is bringing her friend around all the time. But anyway, so Sarah's husband had passed. She's kind of depending on people. She really wants to do something now that she doesn't have this husband to take care of, and her house stays clean. So there was an opportunity for her to do some reading to children at the grammar school, and she wanted to do that. So she was self-motivated, and she was, other than not owning a driver's license, she was pretty mobile. So she did receive some travel training, and can now take the bus from her house to right outside the school. And she goes 2 afternoons a week, and she reads to the little kids. So it's done a lot. I mean, she had to kind of be brave enough to take that step because it's not common. But we didn't need, with her, she was kind of easy because she didn't have limitations other than not owning a driver's license. So our travel trainer met with her at her house, and she just went on the bus with her a couple times. This is how you read a schedule. This is where you get on and off. What it will do is open up for her, like maybe then she'll venture out to take it to her own doctor's appointment instead of waiting for somebody. Maybe she'll go meet somebody for lunch instead of waiting for somebody. The other thing we do with seniors that we've done a lot more are these group trainings. So it's about an hour and a half in the classroom at the senior center. You get a group of 8 or 10, however many you can get. In this instance, we had 5 seniors and 3 staff, which in a rural area is not a bad number. And what we try to do is do a couple of things. That creates bus buddies, so you don't get on the bus yourself, so it's not so frightening. And they created out of that a little lunch club. For that particular group, the RTA brought a bus to the parking lot. People got on and off. They played a little. We did one loop around, just one loop around the town that they were in. But because they were all together, they were just much more comfortable. And they try to go to lunch about twice a week. Not all 5 of them, sometimes all 5 of them. But they're getting on and off the bus, which means that when they need it for something else, it's not such a scary place. And what we're working on now is the YMCA, which is a little ways away from the senior centers, wants to run a matter of balance class. And so we're hoping to try to fill it with people that we can bus over instead of waiting for people that can drive or get a ride over. And we can keep you posted on that. And as I said, once people are familiar with using the bus, they can really take it anywhere that's on the bus line. They can go to the library, the hairdresser, grocery store kind of is limited on what they can carry, but some people can do that. Bank, visiting family or friends, really any place that you can think of to go. And I wanted to close quickly with one story, a personal story about why we really need to get people out of their own cars, especially as they age. My father-in-law in his 80s developed Alzheimer's and macular degeneration and gave up his license. Mother-in-law never drove, so they're kind of home, a lot of kids around, they're okay. And he used to be part of this kind of retired guys club that met at Dunkin' Donuts. And when he stopped going to that, one of the guys started coming to his house. So George pulls up one day, goes in the house. He brought donuts. They're talking. And he looks at my mother-in-law and he says, my son drove me over. And she can see the car in the driveway. And she said, he's been sitting in the car? Let's have him come in and get coffee. So she goes to the door and there's no one in the car. And she said, he's not in the car. And George says, well, I guess I drove myself. And that's a true story. So that's somebody, he thinks he's capable of driving, but he really, people need to learn that it's okay to not drive yourself places, because that stuff is happening every day. So questions, there's my contact information. I know we're a little bit squeezed for time, but again, thank you for coming, and I'll be around most of the day.
And next is Helen Kerschner.
Thank you, Nina. I'm pleased to be here today. It's always great to come to Boston. As you may know, Nina and I have the opportunity to teach 2 online classes, actually, in senior transportation, one for graduate students and one for professionals. So I love to come here. However, we teach our online classes, and I get to do that from Albuquerque, New Mexico, where I'm from. Now, I'm going to change pace just a little bit, but you've heard a lot about older drivers, and you've heard a lot about giving up the keys. And I'm going to ask you, how many of you in this room plan to stop driving, have made plans for when you can no longer drive? Raise your hand. No kidding. I am really surprised, and I think that's wonderful. I think that's a very difficult thing for us to do, and I congratulate you. So, moving right along from the cheeseburger, let's go on to some what I think are senior-friendly options, and there are a family of options out there in the community. And we know about this family, and we hear about the family, and a community may or may not have all these family members. Now, you see there's a golf cart at the very bottom, and that's no joke. There's a community in Orlando, Florida, near Orlando, called the Villages. And the Villages have about 100,000 people, and I understand they have about 70,000 golf carts. And this is a major traffic problem, and people probably need to do some driver training for golf carts. But I'm not going to talk about golf cart training today. What I'm going to do is talk about volunteer driver programs as what I think is a solution. It's a solution for the Berkshires. It's a solution for a lot of communities around the country. How many of you are familiar with volunteer driver programs? If you'd rate, no kidding, this is a fabulous group. So I don't need to talk. You all know, you all know all the answers, and I don't need to be here. But I'm going to stay for a couple of minutes, and we're going to talk about, you've been hearing about these senior challenges, the challenges that seniors face, the fact that many of them are the old, and I would say the old is not the 65 plus population, but it is the 85 plus population that we're probably talking about who are no longer driving. These are people with challenges. The reason that people stop driving are probably going to be related to some physical and some cognitive challenges, and those challenges make it difficult or impossible for them to use traditional transportation services. So we're talking about the seniors who have challenges, who may not be able to pay for transportation, who may not be able to access a public transportation system, who may not be able to qualify for ADA paratransit. So these are probably going to be the passengers, and I think volunteer driver programs are a great solution. They take people to the doctor, they take people to the grocery store, to visit family members, and even to the cemetery to visit all their friends who happen to be located in the cemetery. So these are very important destinations that people go to. Nina and I talk about 3 types of destinations: life-sustaining, life-maintaining, and life-enriching destinations, all of which I think are important, but I think these programs generally take people to medical services. So that's the number one destination. Assistance. Now, this is probably the primary reason that volunteer driver programs work so well. It's to the door, through the door, stay at the destination assistance, help carrying packages. These are things that paid drivers may not be able to do. Bill is going to talk about the risk relationship of volunteer driver programs, and I think it's a very important thing for all of us to remember. And this Little Women, what am I talking about? Well, when I first started talking about volunteer driver programs back in 2000, when the dinosaurs were young in volunteer transportation, people told me, people look at us as little women doing little things. Okay, it's changed dramatically over time. Today, we're talking about transportation services. We're talking about volunteer driver programs as a legitimate transportation service in a community. Okay, so here's the data. I can leave now because here's all the data on 706 volunteer driver programs. I'm going to talk about each of these data components very quickly. This is the number of volunteer driver programs the National Volunteer Transportation Center has in its database. We get these through the Star Award application. These are located in every state except Mississippi. And I was at a conference the other day, and I was talking with some people from Mississippi, and I said, we need a volunteer driver program for Mississippi. They said, there are some, so we need to have more volunteer driver programs. And the question I get from many transportation services, many volunteer driver programs, is when are you going to have your next Star Award program? And that's how we collected this 706 volunteer driver programs. 18, what does that mean? Well, it's the years in operation. Now, there are people who say, well, volunteer drivers programs are new. This is something that's very new. They're not new. We have a program in our database that was started in 1905 using sleighs and wagons to take older adults to the train station and to church. And I think that really reflects the fact that volunteer driver programs have been around for a long time. It's informal. Jana's mother is a volunteer driver. And so it's a very informal thing, but these are organized volunteer driver programs. In the 1970s or the 1980s and 1990s, the Robert Wood Johnson Foundation supported faith in action programs, which resulted in many volunteer driver programs. I think this 18 years reflects sustainability. People talk about these are little programs doing little things. They're sustainable, though. They manage with very little money. And then we're going to talk about money, 64%, 30%. What could that mean? Well, these are the budget ranges. Look at this, 64% of those in our database, now these are estimates, 64% operate on budgets of less than $100,000. That's not much money to provide a lot of rides. 30% in $100,000 to $500,000. One of the reasons they do this is that they provide low-cost rides. They use volunteer drivers, and they use volunteer vehicles. Those are the vehicles of the volunteer drivers. So the vehicles didn't know they were going to be volunteers, but they are probably, and are probably happy to do so. Now, interestingly, government grants are the primary source of funding. However, the chicken dinner also is, for many programs, this kind of fundraising initiative is a major way of raising money. 5 million, we're talking about passengers, a lot of passengers on these volunteer driver programs. High percentage over age 75. The biggest percentage in many programs is over the age of 85. And this is very important because these are the people who may not be able to drive, who have had to give up their keys, who really need the kind of assistance. They know, as I say, they no longer drive. Their destinations vary. Yes, they go to medical health care services. And actually, in our 2014 Star Award survey, it was really interesting to us that 4 out of the 5 top destinations were for health care services. And that's important that people get there, but it's also important that they get other places. And I think it's important that they get out of their homes. And many of the volunteer driver program managers say that not only are they allowing people to get out of their homes, they're estimating that their program enables people to stay out of institutions, out of institutional care for 1.5 to 2 years. Now, nobody has the data yet, but somebody, maybe UMass Boston, needs to look at this kind of data, needs to try to figure out how to determine that, because that has a huge impact on Medicare, on Medicaid expenditures. Okay, 55,000, I've gotten the 5-minute sign, so 55,000, this is the number of drivers we're talking about. 55,000 drivers who are driving in these volunteer driver programs. Keep in mind that's 706 volunteer driver programs. And I think what they do is important. Door to door, door through door, stay at the destination. You can see that 54% of them have been driving 50 plus years. Now, this is data from 2006 in a survey we did of volunteer drivers. 30% serve more than 7 years. So they don't come today and leave tomorrow. They continue driving for a long time. What are their challenges? These would be anybody's challenges driving an older person: incontinence, dementia, assistive devices. Now, I got a call the other day from the head of a motor car company, national car company, and he said, I read stories from the road. I want to do something about volunteer driver programs. I have 5 books, 5 stories from the road. How many of you ever have heard of Stories from the Road? It's the stories of volunteer drivers. I'd be happy to give some of you a book. I have 5 of them with me. So it's a really touching story booklet that tells the stories of about 100 volunteer drivers and why they enjoy driving, why it's important to them. 50,000 vehicles. These vehicles didn't know they were going to volunteer, but they did. Some vehicles, not these are all volunteers, but some of them are program owned. Some of them receive mileage reimbursement, and that ranges from 14 cents a mile, the charitable rate, to 57.7 cents a mile for the business rate. So volunteer driver programs reimburse anywhere within that range. Now, many people do not accept reimbursement for their miles. So it may be offered, but it may not be accepted. 60 million miles driven. These are a lot of miles that these volunteers are driving. And one of the reasons is that I think 42% of the volunteer driver programs in our database are in rural areas. This is an underserved, unserved area for many people, and it really needs to be attended to, and volunteer driver programs can do that. It's very costly to provide those rides when you're using a paid driver. 6 million volunteer hours, a lot of volunteer hours, contributions from these drivers, and you can see that they drive many years. Recruitment is a major challenge, and this is something that we all need to think about in terms of recruiting any kind of driver, but especially recruiting volunteer drivers. And it results in a twofer. Why would I say it results in a twofer? Well, it results in a twofer because of this 1.4 billion. Actually, this is volunteer driver hours translated into dollars using the independent sector value of a volunteer hour at $22.55. This is really important because a volunteer driver program can not only benefit from the drivers themselves, but they benefit from that match that they can use for a federal grant. And one of the things that I mentioned earlier is that volunteer driver programs tend to use their these funds as a match, especially for public grants. Passenger friendliness. Now, this came from the 5 A's of senior friendly transportation, and you have this passenger friendliness calculator on your desk if you'd like to go find a volunteer driver program and evaluate its passenger friendliness. It's kind of fun. And what are we talking about? We're talking about the 5 A's, availability. Nina asked me this in a public session the other day, and I had to come up with this just off the top of my head, but I don't have to today. Okay, so we have availability, accessibility, acceptability, adaptability, and affordability. These are all the abilities that are critical for passenger friendliness, or if you will, senior friendliness. And so in review, we have these 706 programs that were collected through our Star Award program from 2000 through 2014. We know there are many more, probably hundreds more, and we'll be looking for more later on this year. And so I want to close and say, you didn't have to put up stop. Okay, so I want to close and say thank you very much.
Okay, and now we're going to hear from Bill Henry.
Hey, good morning. Well, I'm glad to be here with you today and to have this chance to talk about the risk management aspects of volunteer-based transportation programs. The demand for programs like that is increasing all the time, of course, as more and more elders get to the point where they need to rely on others to take them where they need to go and back home again safely. And there are many great programs out there, as Helen just described. But there's a common concern that often gets in the way. Even though nonprofit organizations and public entities and others that sponsor programs are motivated to have them and to operate them, there's a common concern, and Nina, used the word a little earlier, call it the L word, liability. So today I want to take a look at what liability really is and deconstruct it a little bit and see what we can do to manage it. In elder-friendly transportation programs do have risks, do have liability exposures, but the good news is they can be managed. Of course, liability comes into play because accidents do happen sometimes. So, what kind of accidents happen when volunteers are transporting passengers? Over the 40-plus years that our volunteer insurance program has existed, the most common kind of vehicle accident are accidents at intersections. These are the kinds of claims that we see. In the plenary session this morning, Beth Dugan mentioned the left turns, failing to yield the right-of-way that cause collisions. That's a big one. Also, accidents at intersections include running through stop signs or stop lights, turning from the wrong lane, accidents like that. Inclement weather often is a factor. And other kinds of vehicle accident claims that we see include following too closely and turning improper lane changes. Those are big ones also. However, not all vehicle accidents occur in traffic. We have had claims from vehicle accidents in parking lots, including one fatality. The volunteer driver was not aware that her passenger was behind the vehicle and she backed up. And I mention that because the threshold question in risk management is what could possibly go wrong? That's where you have to start in developing a real robust risk management system. Ask that question and be ready to confront any answer. All right, obviously, we don't want passengers or volunteers to be injured or vehicles to be damaged, but there are other good reasons to take the time and effort to develop a risk management system too. The sponsoring organization's very reputation and support could depend on it. The staff and volunteer morale can depend on it. And your access to affordable insurance also can depend on it. So, how does a transportation program develop a risk management system that it can sustain? Well, it doesn't come prepackaged. There is some assembly required, but there's also no magic to it. Here are the essential elements of a risk management system. First, identifying risks. Then, making sure drivers are properly screened, trained, and supervised. Holding volunteers accountable for following the organization's procedures. Responding quickly to any accident, and having the right kind of insurance in place. All of these measures work together to minimize liability for the sponsoring organization. So let's unpack this. Risk management begins with setting the right tone at the top of the organization. So make sure that your volunteers and your staff understand that safety is a top priority and that you have an unwavering commitment to it. Proper screening includes verifying a potential volunteer's current driver's license, current automobile insurance, vehicle safety inspection, satisfactory motor vehicle record, all of those before allowing the volunteer to drive. And because your volunteers are going to be serving vulnerable clients, it's also a good idea to have a criminal background check and consider drug testing as well. Provide drivers with vehicle safety training, such as the new online training program that the National Volunteer Transportation Center soon will roll out. Keep the training going so that safety remains a focus for everyone in the organization. Know your passengers' special needs, such as assistance to the vehicle or assistance through the door, so that the volunteer can receive whatever specialized training is needed before they make that first trip with the passenger. It's also so important to hold volunteers accountable for following the rules that you establish. You know, we're all volunteer-based programs are glad to get volunteers, but they also have to be held accountable. And just because they're not paid, that doesn't mean they can't be disciplined or even terminated if it comes to that. As you're identifying your risks, dig deep. Ask all the what-if questions that you can think of. For example, what if a passenger should ask the volunteer driver to perform some unexpected task in the home? Something that might present the risk of injury to the volunteer, or that might put the volunteer in a position where he or she is accused of injuring that passenger or maybe stealing something from the home. Think through all the scenarios that you can in your training and address them. But if something comes up that's unexpected, don't leave it to the volunteer's discretion as to whether or not to accept that request. Require your volunteer to put the request on hold until he or she can call the supervisor, discuss it, and decide whether it's something that can be done with acceptable risk before the volunteer agrees to do anything. And then if an accident does occur, see what you can learn from it. Were your procedures being followed? And if they were not, why not? The answers to those questions can help you refine your safety training program. You know, I'll bet at the Clinton County Correctional Institute in Dannemora, New York, they're reviewing their risk management program right now as it pertains to the access to power tools. Risk management is an ongoing process. Risk management also includes transferring to an insurance company the serious risks that you cannot eliminate entirely. Every organization's needs are different, but every organization does have some liability risk exposure that needs to be insured. By the way, if anyone is under the impression that the Federal Volunteer Protection Act of 1997 or any of the state laws that are modeled on that federal law provides immunity, please understand that those laws, the federal law and all the state laws, exclude acts of what's called gross negligence. Now, plaintiffs' attorneys can make that term very elastic. Those laws also exclude anything arising out of the operation of a motor vehicle. So really, volunteer immunity is mostly an illusion. The organization operating a volunteer-based transportation does need, almost always, a general liability policy and what is called a non-owned and hired automobile policy. We have all these exotic terms in insurance for the various policies. The general liability policy protects the organization against allegations of bodily injury, personal injury, property damage. The non-owned and hired auto policy protects the organization if one of your employees is driving his or her own vehicle and causes an accident. Those are almost always called for. Also, to make sure that the dollar limits of those policies are preserved for the organization itself, it's also a good idea to insure your volunteers separately, because you don't want to be sharing limits with your volunteers if they should be at fault in a serious accident. For the transportation risk exposure, you can obtain excess automobile liability coverage for those volunteers very inexpensively. It's a benefit to them. That way you're not sharing your own dollar limits. It's a benefit to them because many volunteers are driving with very low liability limits on their personal auto policies. So if they're at fault in an accident, they could have a very serious out-of-pocket loss, but your sponsoring organization can pick that up by offering the excess auto liability coverage to them and paying for it, of course. Just one more point about insurance. This question comes up a lot. Occasionally, an insurance agent will say to a volunteer who's their customer for their personal auto coverage, you know, you really shouldn't volunteer because your coverage might be canceled, a claim might be denied, your premiums might go up if you're a volunteer driver. No, that's not true. There is no insurance company as of today that would take an adverse action like that against a volunteer driver. So don't let that be a barrier to the recruitment of volunteers or the operation of your volunteer-based program. Thank you for allowing me to suggest a few fundamentals of risk management for your volunteer-based program. As Nina mentioned, I do have a few handouts on the table for you. Here they are right now. And if I can ever be of help to you, there's my contact information. Please give me a call. Thank you very much.
Now, how many of you think that he's scaring you away from doing volunteer driver programs? Okay, that's good, Bill, because I mean, you really are in favor of volunteer driver programs, right?
Absolutely.
Okay, great. Thank you very much. Okay.
To do it right.
You just have to do it right, absolutely. Okay, so now to our discussant, and he likes to be referred to as a pundit. We have Noah Berger from the Federal Transit Administration.
Thanks, Nina, and thanks to my fellow panelists, and thanks to all of you. Also, I wanted to give one additional thanks to Mary Leary, who's in my headquarters office, who brought me and Nina together. She wasn't able to be here just because of transportation is a barrier for everything, and she couldn't make it from DC to Boston. But this is a subject that's near and dear to her heart. So when I first saw the initial draft of the program, I was listed as a discussant, and I called Nina up and said, what is the role of a discussant? And we talked about it. It turns out it's great because they don't have to prepare a PowerPoint. So actually, we can make that bright so the room is bright. I don't know. And I don't have to back anything up. I just get to comment on things that other people said, which is actually an ideal role for me. As Nina identified, I'm with the Federal Transit Administration. We're one of I don't even remember how many modal agencies within the U.S. Department of Transportation. The one that you tend to hear about, I think, was actually listed when they flashed all the sponsoring organizations was the Federal Highway Administration. They get all the money and all the kudos, but we're buses, trains, ferries. So I think we have a very important role to play, particularly here when we're talking about when people are transitioning out of driving. So as for myself, my background, like Jana, actually, I my first job in transportation was with a community action program. That was up in Burlington, Vermont. It was funded out of the Enterprise Community Transportation, the Enterprise Community Fund. I headed up the Enterprise Community Transportation Project, and we had a staff of one. So I took all those arguments at work home with me and lost them all. But what the goal of that project was to fill gaps, particularly around the low-income neighborhood of the Old North End in Burlington, and to tie the services that we were putting out and helping folks there into the existing transportation network. And I think that's the idea of filling gaps is sort of a theme that we've been talking about in various different forms throughout this session here, and I think part of what as it was an idea, we're the first of 3 different sessions on the mobility track, so we get to start with the big theory, and then it's up to the later sessions to actually talk about implementation. But I'll try to talk a little bit too about what things we can learn from what folks talked about here that we can specifically use here in Massachusetts. So I'm gonna take at this point I'm gonna take a fairly unorthodox move here. I'm gonna take on Nina, who's the inspiration behind this panel and much of this conference. Just one slide. It's a friendly take on, but I think you ended by saying that if driving cessation is recommended, then other mobility options should be explored. And I would just urge in future presentations not say if, just say whether or not driving cessation is recommended. Other mobility options should be considered, and in fact championed and celebrated. Because first of all, it does a number of things. One, for most things in life, things are gradual, right? And sometimes when you have those off the cliff sort of catastrophic moments, that's self-imposed. So if we have for most people, I mean, it shouldn't be the case that when you stop driving, it's an automatic thing. You go from going 90 miles an hour on the highway to not driving at all. There's a gradual change. You might stop driving at night. You might not want to drive in downtown Boston, but it's okay to drive in your hood, et cetera. So if you ease that transition and you make it less punitive when the keys are taken away, and something you've already done, something you're familiar with the other options, that probably will make it so these conferences are less there's less hand wringing in.
Let me interrupt because I can. So no, I actually accept that, and in fact I do believe that that we should be just as Jana had said that we should be doing knowing other modes of transportation earlier on in our lifespan, and it won't be so threatening. But yes, rather than restricting your space, start using other modes. At night in bad weather or whatever, so that you're more comfortable. So that's fine. I'm okay with that. No.
See, it's no fun to take someone on if they say I'm okay with that. For those who have heard me talk on similar subjects, one thing that is, I think, very important to be aware of and something we often forget about, and particularly in situations like this, where we're bringing people from a human service background together with people from a transportation background. There are two very different visions of what transportation is, particularly public transportation. One is that it's part of the infrastructure, and it's there like the streets and the roads, and it's open to everyone. The other is that it's a safety net. And if your vision of transportation is safety net, you have a very different mindset. You're thinking about eligible riders. You're thinking about eligible trips. And I think ultimately, we know we've achieved success if it's part of the infrastructure to the point that you don't have to worry about a safety net. Obviously, that's a ways to go, and you always have to worry about the people who aren't being served by the predominant form of transportation available. But that's something to be aware of. And I love, so Jana, in your slide when you talked about the possibilities being endless, and you listed, and although most of the things you listed people want to go to are fairly noble things, and I think also if you include going to the bar. Going to a strip club, because ultimately it should be nobody's business but your own where you're going. Just throw that out there. And also Helen, I love your discussion of the family of services available. I love that there's you show all those senior citizens hanging off the cable car, and I think that's the goal. It should be seamless. The family, it should be interconnected. Even within public transit, we talk about paratransit is so separate from the fixed route service. I would love to see more of an emphasis, and some of it is just how you structure the contracts, how you bill the service. Not bill as in charge, although that's part of it too. But how you market it, so it's more of a feeder service. And again, Helen, you talked about the sleighs and the wagons in 1905, taking people to the train. Right? Taking people to the train. So the problem is not that they couldn't ride the fixed route anymore. They just couldn't get from where they lived to where the fixed route was running, the fixed route of that era. So we again, just thinking of our modern day sleighs and wagons, getting to, if you can just get someone to the train station, to where the fixed route bus is, that also eases the transition and makes the options much more plentiful. And Jana, also, I love the emphasis on training, because that's I think I want to caution people not to create overly niche systems where you overly target this population or that population, and you have a very fragmented system where everything is you have to fit in one category, another category, and it's a different system for each one. With the training, though, it's an opportunity. That's where you get to be niche, not in the services you provide, but in how you tailor the training program for the very individualized needs of the different participants in that program. And I think sometimes one thing we often forget about this, the Cheers line where everybody knows your name. That's often great in terms of transfer, and it's great when you call up a demand response and they say, hey, Noah, hey, yeah, great, how you doing? But the problem is that can be very intimidating to the uninitiated, very intimidating to the person who's not yet in the system. And I'll give you a short story. When we did an assessment of a transit authority here in Massachusetts, and I won't call them out, but their initials are the Merrimack Valley Regional Transit Authority. And we went to the reservation room, and this is they're in Lawrence and Haverhill. This is a very high Latino population there, and all three of the reservationists didn't happen to speak Spanish. So we asked them, what do you do when people who only speak Spanish call up? And their response was, well, people who speak Spanish don't tend to call. And when they do, our fixed route morning dispatcher, she's bilingual, so we try to get her, but it's not really an issue. And of course, that's that speaks for itself. It becomes a self-fulfilling prophecy. So always be aware when you reaching out to those who are not part of your system. Finally, I want to talk a little bit about we talked a lot about volunteer driving programs, and I think Bill, when you talked about setting the tone, I think that's very important, and it's very important for an organization to look internally as to what your goals are, how this fits into the system. And I want to throw a little caution out, and this is something that actually Helen thought she was taking me on when I raised this, and I didn't even know I was being taken on, and she did it in such a fabulous way. So, but my experience with driver, there's sometimes a dirty little secret, and that is a lot of the volunteer drivers, who, by the way, are often senior drivers themselves, are involved in the program at one level because of the mileage reimbursement. And that's not to impugn anyone's motives, but it's just to be aware, if you're paying someone less than someone should be paid to run the program, and we know the cost of operating is cheaper if you're paying the mileage reimbursement than if you're paying the salaries that a driver would otherwise command, then I think you have to look very closely. And I think as Bill was suggesting, you have to do it right, and you have to set the right tone, and you have to make sure that there's an understanding. I think there are too many examples, and some of this are before the data that Helen presented, but I was aware of a situation in Vermont where the volunteer driver couldn't make the trip and asked her nephew to perform the trip for her instead. And he did, and unfortunately he assaulted the passenger. And again, that's an example of perhaps the tone wasn't set right, perhaps the accountability wasn't set right. It's very easy to fall into volunteer privilege, and it is a great thing, and it's a fabulous thing, but you also have to go in with your eyes wide open. So I'm going to conclude by just throwing out certain themes that I think we want to think about and figure out how we can incorporate even stronger than we do right now. So family of services, filling gaps, seamlessness, integrated transportation, and again, infrastructure that requires no net. So thank you.
Okay, thank you. Okay, questions? Questions, come on. Reactions, comments? Okay, so your name and where you're from and what your question is.
Hi, my name is Theodora Fisher, and I work with Mass Mobility. My question is for Bill. I work a lot with volunteer driver programs myself, and I always recommend that they get Registry of Motor Vehicle records for their volunteer drivers. And I know you mentioned that too. And the question I got that I felt like I couldn't really answer comprehensively was, what standard do you hold that record to? What marks against them on that record would you accept or reject? So I'm just curious about your thoughts on the standards for those driving records. Thank you.
Yeah, thanks, Theodora. One of the handouts that I have for you on the table is what we call an acceptability checklist for motor vehicle records. It provides an objective standard for evaluating it, sort of a flowchart idea. If you get to this question and your answer is no, or your answer is yes, as the case may be, stop there. The driver isn't qualified.
Okay, next question.
Hi, Bill Schwartz with the Collaborative. I think this is a question for Helen. One of the things that I'm really, I learned actually at Albuquerque at the CTA conference there a couple of years of a program that has a dedicated funding source that comes, it's Marin County in California, it's a dedicated funding source that comes out of a registry of motor vehicles surcharge that helps fund their program. And I'm wondering if there are others and what the trend may be in terms of providing funding, because we have to scale it up so much larger. The money is the biggest concern.
Is this working? Yes. I think your question is really good. There are not a lot of programs around the country that are funded by public transit, by the kinds of funds that you're talking about. I think that is the hope of the future, if you will, because Ride Connection, and I think you probably are familiar with Ride Connection in Portland, Oregon. Ride Connection was started by TriMet, the public transportation service. It seems to me that that is an important model, just as secured funds from public are really important for the support of volunteer driver programs. This isn't happening a lot. RTAs are now, regional transit agencies are beginning to help coordinate volunteer driver programs, create a network of volunteer driver programs where, in fact, they may purchase software and integrated software for them. So this is something that is, I think, beginning to happen. I think something else that's beginning to happen is that community transportation programs and private transportation programs are starting to begin developing volunteer driver programs. And I think that's one of the things that we can watch very carefully, because I have said for a long time that volunteer driver programs, many of them are very small. And it seems to me that when a community transportation program or a public transportation program is thinking about organizing its own volunteer driver program, it should look around the community and see what's there, because in many communities there are these small, very active and very successful volunteer driver programs, perhaps underfunded, but they're very successful. And if a community transportation or somebody with a lot of federal money decides to start a volunteer driver program without knowing what's in the community, it's really a sad thing. So it seems to me that that should be very high on the agenda. I don't think I answered your question.
I have a question or comment for whoever might take it. Lissa Kappas from Beth Israel Deaconess Medical Center. So I run a program that, as Nina describes, is the program that helps to take drivers off the road who are no longer safe to drive. You do driver That's what I do, driver fitness. Okay, driver fitness. Joe Coughlin and I were on an NPR radio show a couple of years ago, and you'll be hearing from him later. I really appreciated hearing that not all people who rely on volunteer programs have noble medical appointments or church. I mean, some of them may want to go to the bar, may want to do other kinds of things. But he talks about, and I just love this concept, the ice cream test. Have people heard of Joe Coughlin's? So here's how it goes. You've got two older people sitting on the porch, 7 o'clock in the evening, and it's a really hot July evening, and one turns to the other and says, gee, I could really go for a pistachio ice cream cone right now. And the other one says, absolutely, I can just taste it. So he says that we're not going to get people to surrender their licenses easily because in this country we really don't have good alternatives, and he compares certain European countries and towns and cities. He said until you get to a program where on a hot July evening you can go for that pistachio ice cream cone, the kind of spontaneity of a wish that comes up as opposed to a pre-planned doctor's appointment. And if we think about quality of life for all of us, it's the spontaneous trips that really are what we value. So I'd like to hear about, are we moving that way with these volunteer programs? Because it sure, I think, would improve quality of life, both for the planned and the not planned trips.
So I want to jump in first with travel instruction, because that's really what it's all about. It's letting people live spontaneous lives and not have to pre-plan or make phone calls. If they know how to use the bus and the bus is they're able to get to the bus, they can go for that ice cream cone because they'll know the schedule, they'll know the stops, and they'll be able to just jump on with their $2.50 or their Charlie card, and off they go.
Well, and I want to respond to that because I think if they can get to the bus is a really big deal because they can't all get to the bus. And that's where the volunteer driver programs, I think, fill that gap. And I think your question and your point is really good. It depends on how the volunteer driver program is organized. If it's organized as a 9 to 5 program where it's only providing transportation during office hours, then it's probably you're not going to be able to get to the ice cream shop at 7 in the evening. However, many volunteer driver programs are moving away from that and into a milieu where the volunteer driver can make those reservations directly with the passenger, so that, and this is passenger matching, and I think those programs really are a little bit different because the volunteers and the program work together and the passengers all work together. And so if the passenger wants to, and they provide 24/7 service if the driver is willing to do that. And so I think that becomes an agreement between the driver and the passenger. It seems to me that's very important. There's some different models out there that some of you may be familiar with that enable you to do that. To me, that's the way we should be going, and I think that's the way many volunteer driver programs are moving.
Okay, this is Nina, just one comment, and then we have one more question, and then I think we're at our point where I can we need to go get your coffee break and then continue on informally. But my comment on that in response to Lissa is the whole concept of trip chaining, that the idea is that we get up in the morning and we might go to multiple places. You go to work, you might stop at the grocery store, you might go to the hairdresser and everything else. And it's what Mary Larry refers to as a spontaneous life, and you did use the word spontaneous. And I think that should be a vision and a goal for us to think about being able to go to where we want to go, when we want to go there, and how we want to get there. And now a question by David Klein.
Nina, can I just add one thing too that just.
I don't know, you're not too nice to me.
I was. So, I think one additional thing there, and by the way, I really appreciate the ice cream example. I think I'll use that instead of the ones I use. But it's. I like yours. Okay, all right. But one thing that we have now is that technology is different than when we first started thinking about this. And so if when all the paratransit regs were created, you had to reserve it a day in advance because you had to, because there's no way logistically to do it. Now we have the tools to do same-day reservations. I think transit agencies aren't doing that for paratransit because there's opportunities to leverage that for other benefits. But I think in other programs, there are ways now that you can use that technology that didn't exist just a few years ago.
David has a comment, and also then the break, but I just want to tell you the other mobility tracks sessions are right in this room.
So in case I can't get my full question out, I just want to give a plug for Nina and Helen's organizing and managing senior transportation options certificate class online through UMass Boston. So quick question for Helen and also for Bill. Helen, the slide that showed the cost, I think it was the cost of transportation per hour, and it showed Arkansas at $18 per hour. What was the other state that was 38?
It was DC.
Okay, DC. So I think that's an important takeaway for me is the real cost of what transportation is, and
Well,
the,
that's the reimbursement rate.
oh, the
That's the
reimbursement.
reimbursement rate for those, and the national rate by the independent sector is $22.57. However, it varies by state.
Okay.
So Arkansas had a very what would be considered a very low rate, while Washington D.C. I was surprised at that. It's very high.
Oh, okay. I was writing down the reimbursement rate per mile, but that's the reimbursement rate per hour. Is that?
No, that isn't reimbursement. That is the value of the volunteer hour.
Oh, yeah, the value of the volunteer hour. Right. That's really what I thought you meant. Yeah. So I think that's an important point to drive home. And the other thing for Bill is the insurance for the volunteers. It keeps getting presented, but I have the feeling that it's not really utilized as much as it should be. Am I wrong about that?
Not utilized.
In other words, not people. You're presenting it, but not enough people are taking you up on it. I know. I keep thinking about doing it for my community. I run a council on aging, and I haven't done it yet.
Well, here's what happens often. The transportation program sponsor meets with the insurance agent once a year to talk about the insurance renewal, and they might ask, "Are our volunteers covered?" And the agent says, "Yes, your volunteers are covered." And that sounds good. But it's not good if you think about what might happen in a serious accident. If you have a $1 million limit of liability and you are faced with a judgment or a settlement of $1.5 million, and the insurance company doesn't care whether the $1 million is used by your volunteer or by you. So you could find yourself with a serious out-of-pocket loss if you're including volunteers on your liability policy. You can take them off. They're covered automatically, but there's a very simple procedure which any insurance agent should know to exclude volunteers from your organization's policy, and then insure them separately.
And the other thing that we learned about from the class, from the certificate class, and that I think there's information on the Human Service Transportation website that Theodora runs, is that the cost of this volunteer insurance is really very minimal.
$7.30 per volunteer per year.
Okay, that's a positive note, and as long as Bill gave us one, I'm going to stop at that point. But let's have a round of applause for this panel.